Cushing's disease is a condition where the pituitary gland, a tiny pea-sized organ at the base of the brain, makes too much of a hormone called ACTH. ACTH tells the adrenal glands, on top of the kidneys, to release cortisol. Too much cortisol makes the body act as if it is under constant stress. Think of the pituitary as a manager that is shouting, "Produce more cortisol," all the time, even when the body doesn't need it. The main cause of Cushing's disease is a benign tumor on the pituitary gland, called a pituitary adenoma. This tumor produces excess ACTH. Rarely, other problems such as genetic mutations in the MEN1 gene or exposure to certain medications that mimic ACTH can also trigger the disease. Imagine the tumor as a stuck accelerator pedal in a car. It keeps the engine revving high. Common signs are a round full face, often called moon face, a fatty hump between the shoulders, called buffalo hump, thin skin that bruises easily and may develop purple stretch marks, weight gain, especially around the belly and upper back, weak muscles leading to trouble climbing stairs, mood changes like irritability or depression, high blood pressure and high blood sugar. A simple way to notice: ask a friend to compare an old photo with a recent one and look for a fuller face or new stretch marks. Doctors first check cortisol levels using a 24-hour urine test, late-night saliva test, or a low-dose dexamethasone suppression test, a pill that should lower cortisol. If these are abnormal, an MRI of the brain looks for a pituitary tumor. Treatment options include surgery, removing the tumor through the nose, transphaneal surgery, is the first choice. Radiation, small doses of focused radiation, can shrink leftover tumor cells. Medication, drugs like ketoconazole or pasireotide, can block cortisol production when surgery is not possible. Think of treatment like fixing a leaking pipe. You first try to stop the leak at the source, surgery, then seal any remaining drips, radiation, or meds. There is no proven way to stop the disease before it starts because the tumor grows spontaneously. However, early detection helps. Regular health checkups that include blood pressure, blood sugar, and weight monitoring can catch clues. If a person notices rapid weight gain, a round face, or easy bruising, they should see a doctor promptly. Lifestyle habits such as a balanced diet, regular exercise, and stress management keep overall hormone balance healthy, but they do not replace medical evaluation. Recent advances include improved MRI techniques that can spot very tiny pituitary tumors, making surgery more accurate. New drug pasireotide that targets specific receptors on the tumor, reducing ACTH and cortisol with fewer side effects. Genetic testing for MEN1 and CDKN1B mutations, helping identify families at risk and guiding earlier screening. Endoscopic surgery with high-definition cameras, which shortens recovery time and improves tumor removal rates. These developments are like getting a higher resolution map and better tools for a surgeon, leading to faster diagnosis and safer treatment.